People who had COVID-19 are at higher risk for a host of brain injuries a year later compared with people who were never infected by the coronavirus, a finding that could affect millions of Americans, according to U.S. researchers. A year-long study, published in Nature Medicine, assessed brain health across 44 different disorders using medical records without patient identifiers from millions of U.S. veterans. Brain and other neurological disorders occurred in 7% more of those who had been infected with COVID compared with a similar group of veterans who had never been infected. That translates into roughly 6.6 million Americans who had brain impairments linked with their COVID infections, the team said. Al-Ali and colleagues at Washington University School of Medicine and the Veterans Affairs St. Louis healthcare system studied medical records from 154,000 U.S. veterans who had tested positive for COVID from March 1, 2020 to January 15, 2021. They compared these with records from 5.6 million patients who did not have COVID during the same time frame, and another group of 5.8 million people from the period just before the coronavirus arrived in the United States. Compared with the control groups, people infected with COVID had a 77% higher risk of developing memory problems. Researchers said governments and health systems must devise plans for a post-COVID world.